welcome back for this section where we're going to learn about the different subtypes of connective tissue. And so when we're talking about connective tissue types, we're going to learn about 6 of them. And so by the end of this section, come back to this picture and you should be able to tell what each of these 6 are. So, in order to name them, you have to be able to remember the names of them. And for years, students have struggled to remember the names of them. And so one thing that I do to help students is kind of like give you an easy way to remember is like, what kind of grade do you want? You want an A. And if you can't get an A, you want an A minus. And if you can't get an A minus, you want a B. And if you can't get a B, you want a B minus. If you can't get a B minus, you want a C. And if you can't get a C, then you want a D. And so I kind of put them in alphabetical order. They start with an A or A minus or a B or a B minus or a C or a D. Okay, so those are the 6 types of connective tissue we're going to learn about in this class. So let's get started. The first one is called areolar connective tissue. So everybody say that word, areolar connective tissue. Okay. So hopefully you recognize this picture, areolar connective tissue. This is the photomicrograph that goes with that cartoon drawing when we were learning about what connective tissue was. It's the exact same subtype. It's very unorganized. It's the one that connects different types of tissues. It's the widespread packing material. It's the most common type found everywhere in your body. When you look at it, histologically, do you see here how this looks very white, like there's almost nothing in it? Yeah, the matrix can appear empty. Why? Because there's a lot of water in it. And so it just doesn't look like there's a bunch of stuff in it. Okay. So that's why it's a great universal packing material. All right, the second type, adipose tissue. Adipose tissue is adipose tissue because it's storing lipids. So you have big inclusions in the cells of lipids. So when you look at the cells, they look empty. So here is the cell. The nucleus is smushed way over to the edge because each cell is jam-packed 98% full of lipid. And there's a great blood supply. We see lots of little capillaries all over the place because we need to be bringing stuff in. And when we break down the lipids, that's going to be a source of energy. So we need to have good blood supply here going on. Adipose tissue also is good thermal insulation, keeps you warm, and also is great organ protection. We've got 2 layers of adipose tissue that surround our kidney, along with 2 layers of a different type of connective tissue, the dense connective tissue we'll learn about shortly. So we have 2 layers of each of those surrounding our kidney, trying to protect our kidney from being damaged. Okay. And here's the thing about adipose tissue. We never lose the number of cells that we have unless you get liposuction. What happens when you lose weight or you lose fat is the cell size shrinks, which means it's very easy for the cell size to get bigger later on. Okay, you're not losing the number of cells. And if you do get liposuction and then you put on weight, you're going to have very funky looking adipose tissue because where you had the fat cells sucked out, obviously you're going to have a little dimple there. Okay, so we're done with the A's. Now we're going to move on to the B's. And remember, there are 2 B's. So the first one I'm going to talk about is blood. Blood is unique among the 6 types because it's the only one where the ground substance is a liquid. And we call the liquid matrix plasma. Okay. So the extracellular matrix is called plasma. And in the plasma, we're still going to have cells. Okay. And the whole purpose of blood is not the connect stuff. Totally different function than the areolar connective tissue. The whole purpose of blood is to transport substances throughout our body. Okay. And to see what it's transporting, we have to look um, further when we do the cardiovascular system. But we have three formed elements. Okay. We have what you know as red blood cells. Later on, you'll learn them as erythrocytes, which just means red cells. These are these round things that don't have nuclei in them. Then we have these larger cells with funny looking nuclei, and these are your white blood cells or your leukocytes. And then we have these smaller things, of which there are bunches of them, which aren't cells, they're cell fragments. And these are your platelets. And so blood is carrying oxygen to the tissues, it's carrying carbon dioxide away from the tissues because it's a waste product we're going to exhale in our lungs. It's carrying things that are going to have to do with blood clotting. It's carrying things that are going to have to do with keeping our pH of our body normal. There's lots of stuff that blood's going to do that we're going to learn about later. All right, our second B type of connective tissue is bone. And here, this is also a unique extracellular matrix in that it is hard, it's calcified, and the cells are trapped in this calcified matrix. Now, when the cells were doing their thing, when they were blasts, it wasn't calcified. But then when they secreted calcium, then it became calcified and they got trapped. Okay. And when we look at bone, you can see that there's areas that look very solid, and then there's areas that look like your kitchen sponge, especially if we look at it in a higher power. And so we call these two structural types spongy bone here in the middle, and the edges we call compact bone. And if we look at them under a light microscope, we can see that the spongy bone has these little things that look like little pieces of coral with lots of spaces. And the compact bone doesn't look quite so solid. It looks like a lot of little tree trunks. So we got some stuff we're going to learn about when we come back and learn about the skeletal system. So that is bone as connective tissue. Now we're ready to move on to the C connective tissue, and that is cartilage. So cartilage is found on the ends of our long bones where we have a joint. And cartilage is mostly collagen. However, the matrix is up to 80% water. And so what that does is during the day when we are upright, it means it can compress, but at night when we're lying down, it will spring back. So yes, it does mean you get shorter as the day goes on, and then you're taller first thing in the morning. It also means because of the collagen, it has strength. Yes, it's tough and it's flexible. Collagen has flexibility. It doesn't stretch, it doesn't lengthen, doesn't stretch, but it's flexible and so can absorb some shock. Okay. Here's the thing about cartilage: no blood supply. What does that mean? It's really, really, really difficult to heal injuries. If you ever follow professional athletes and you hear about them getting injuries to their medial or lateral meniscus, you know that that can be a career-ending injury. And it also doesn't have any nerve fibers, which means you can tear your meniscus and not feel any pain. And you go on, but yeah, that athlete had pain in their knee when they got injured. Well, that's because they injured more than just the meniscus. They tore ligaments or tendons at the same time. And those things do have nerves. Okay. And there's one other piece about cartilage that's bad news. You stop making new cartilage when your skeleton stops growing. So as a child, you're making new cartilage, which is great. In your adolescence, when you're having your growth spurts, you're still making new cartilage. But once you quit having your growth spurt, whatever age that is, you're not making new cartilage. So the only thing you're doing is trying to repair the cartilage you have. And by the time you hit your mid-20s, that starts being a losing proposition. By the time you hit your 30s, it becomes very, very difficult to do. By the time you hit your 40s, that's not going to happen. By the time you hit your 50s and 60s, mm-mm, mm-mm. So whereas when you're a little kid, you can jump off the walls and you injure your cartilage, no big deal. When you're a parent, let your child show you up. Don't try to keep up with them. Because if you injure your cartilage, you're not making new cartilage. Okay. All right. So we actually have 3 types of cartilage. This is the type of cartilage that we find that athletes are injuring. Do you see how it kind of looks like sea glass? What's called a glassy appearance or ground glass appearance. And here's the other thing about cartilage. Each one of these little cells looks like it's in a little hot tub, doesn't it? Yeah, because it is. It's in a little space, okay? So in cartilage, all of our cells are in a little space. And this type of cartilage is known as hyaline cartilage. And so, yeah, there's a lot of collagen there, but because of the amount of water, it has a very glassy appearance. And this is the type we find at all of our articulations, our joints that are mobile, all of our synovial joints, and also at our epiphyseal plates, where we're all of our growth plates. The second type of cartilage is elastic cartilage. And it's called elastic cartilage because it not only does it have collagen, it has a lot of elastin in it. So it has all of these little thin elastin fibers. So you'll be able to tell that because the stain shows the little elastin fibers, whereas this one doesn't. And you can clearly see all the little spaces surrounding the cells just as well. There's only 3 places in the body that have elastic cartilage. Your right ear, you know that because there's cartilage here, and yet you can sleep on your ear and it's bent and it will return to its resting state. So your right ear and your left ear are 2 of the 3 places. The third one is a place in inside your throat that flaps every time you swallow to keep contents from going down into your windpipe. And that's known as your epiglottis. And we will learn about that later when we learn about the respiratory system. The third type of cartilage is known as fibrocartilage. So look, once again, we have the cells and each cell is in its own little private hot tub. So did you notice that for all 3 types of cartilage? But what's unique about this one is you see thick rows of collagen. So this one has tons and tons of collagen. So giving it even more strength. And so this is the type of cartilage that's in your meniscus and in your discs between your vertebrae. Okay. So that's all I have to talk about with cartilage. And so we're done with the C. We've done our 2 A's, we've done our 2 B's, we've done our C. All we have left is our D, and that is dense connective tissue. And so here, once again, we have lots of collagen closely packed, but now we have crowded rows of fibroblasts. And at first glance, you might think, oh, Dr. Powell, that kind of looks like fibrocartilage. But let's go back and look. Do you remember here? We had the hot tub surrounding all the cells. Do you see hot tubs surrounding the cells? No. And you see here fibroblasts, long, skinny, because they're producing fibers. Here, do the cells look long and skinny like fibroblasts? Not so much. Okay. So can you see how they look different from each other now? Yeah. So you need to pay attention to details. All right. So because of this, dense connective tissue is sometimes called fibrous connective tissue, and you may hear me call it dense fibrous connective tissue just to help you remember what it looks like. All right. And it's the alignment of these fibers that's going to give it its strength in the direction that those fibers are aligned. Now, this has very few blood vessels. Okay, it does have a few. And so a little bit of nutrition's coming in. There's going to be a lot of diffusion, but there's a little bit of nutrition. So what does this mean? It means it can heal, but it's going to take a long time. So we're not talking a week or two. We're talking 4 to 6 weeks, a couple of months. But it will heal, usually, unless there's a lot of scar tissue from previous injury, because scar tissue doesn't have blood vessels. All right. Now, when we're looking at dense fibrous connective tissue, there are two subtypes. There's dense regular, which is what I'm showing you the picture. Dense regular means all the fibers are aligned in the same direction. This is dense regular. Do you see how all the fibers are aligned in the same direction? Okay. What that means is our strength is in one direction. This is what we need for our tendons, where the muscles are attaching in one direction. We need our strength in that direction. This is what we have in our ligaments and also in other structures, which are like tendons and ligaments, known as aponeuroses and fascias, which we probably won't talk about in this class, but if you take anatomy, you'll learn about them in anatomy. Now, as opposed to dense regular connective tissue, we have dense irregular connective tissue, which, as you can see, we've got fibers in every direction. These are going up and down. These are going sideways. These can go back and forth. Okay. This gives us strength in multiple directions, right to left, front to back, up to down. This is what we have in our skin, surrounding our joints, surrounding our heart, surrounding our soft organs, because we need strength in multiple directions. Okay, so 2 things I want you to do. First thing, a quick think. I wrote different functions for different types of connective tissue. Go through, think about, first thing, write down your 6 types of connective tissue without looking them up. You should be able, because remember, A, B, B, C, D, and then try to link them up. Maybe more than one type does more than one function. And then when you are done, name all the components of all connective tissue. Name, by the way, that's a homework assignment too. Name the major subtypes of connective tissue. Hopefully you did that on the previous slide. And then go back and identify pictures and state reasons why it is that subtype. So thank you so much for all your hard work in understanding the different types of connective tissue. And I will see you shortly when we come back and we talk about 2 different types of tissue in one video. See you shortly.